Hello, this is Justine Calderwood, and I am here today to talk about how physical therapy can help with breastfeeding. August is National Breastfeeding Month, and so I felt like this was a great topic to start the month out with our Facebook Lives. So first I want to say here at the Healing Spot, we help women have active, healthy pregnancies, smoother deliveries, and a more complete recovery postpartum, so you can get back to the active lifestyle that you like without pain and limitations. And let me tell you, some of my postpartum moms I see newly postpartum, like within days, if they're really having issues with breastfeeding. Some of them develop breastfeeding issues a while into their postpartum period. So I'm going to talk to you today about some common complaints that I see as a physical therapist, as a women's health physical therapist, and give you a little bit on how I address that, because you might not think that physical therapy, like, that's not often prescribed for breastfeeding issues. If you're talking to your OB, you're talking to your midwife, postpartum, your lactation consultant, they might not know that physical therapy can help. Now I offer, I gotta say, a more like a comprehensive, a little bit outside the norm of physical therapy. I want to put that in quotes, physical therapy, because you won't find this down the street. Okay, so I want to be clear on that. So let's talk about some common issues that you might be experiencing as a new mom, or even in this postpartum phase. I know you might be breastfeeding for quite a while. It might even be after that first year, and so some of these issues might crop up early, or they might take a little bit of time. So one of the things that I see moms for is low milk supply. It's the early phase and they're just not getting the milk to come in. Maybe one side is not producing the same as the other side. And that's measurable if you're expressing milk, if you're pumping, that is measurable, or if you're weighing baby, before and after feedings. And so low milk supply is one thing. Pain with latch on, okay? So if it's really hurting you, I've seen women with just extreme pain into the nipple, going back into the back, kind of shooting through the breast tissue. Engorgement, or swelling, I've heard it called, but like basically like one breast is way bigger than the other side. Like it's simply not draining. It's getting swollen. Okay, mastitis, which is a clogged milk duct, or recurrent mastitis. So if you're getting mastitis over and over and it's simply not clearing, consider physical therapy, okay? And I'm going to tell you what I offer. Postural pain with breastfeeding. So I know you may be breastfeeding on your side, sitting up, that kind of thing. So if you're starting to develop some issues into your neck and back, maybe your shoulders, developing some headaches that weren't there previously, it might be, simply the positions in how you are holding your body to feed your baby, okay? And then I want to also talk to you about some things that you might notice in baby. Maybe you're having a great time and things are going fine, but baby is really colicky or having a lot of reflux, not keeping that milk down. It's just coming right back up. And although they're gaining weight, you notice more in your newborn, okay? Maybe poor latch on. Maybe there's a question of whether there's a lip or a tongue tie, okay? So how do I address this as a physical therapist? So first, I look at the body as a whole. And so when people call me on the phone and when I get to starting with them, I just let them know, look, we're going to address, particularly what issue you're dealing with around the breast tissue itself. But I'm going to take a step back and look at you as a whole, and I ask about any pre-existing, like, back issues or shoulder, headache, those kinds of things, because that starts to clue me in on what was mom's body like before she had this baby, and what could be contributing soft tissue wise that might be contributing to some restrictions around the breast tissue, okay, and causing some issues with feeding, okay? So I really look at the fascia. It's just a medical term for the soft connective tissue in your body. It can put up to 2,000 pounds of pressure and pull in your body. Okay, so let that sink in. I mean, that's a ton. So if you have some restrictions, say, around your chest because of poor posture, because maybe you had a surgery, maybe even down here a surgery, maybe you had a previous injury to your back or your hip, and that's causing these restrictions. That can lead to restrictions in other areas of your body, again, into the breast tissue itself, okay? So what I do as a physical therapist, I look at that, I look at the strain patterns, I'm looking and feeling with my hands where that might be, and this comes from experience and training, okay, specialized training. We also look at the breast tissue itself. You know, I know that's where a lot of moms are thinking, okay, that's where the problem is. So we do narrow in on that as well to treat that, to address that, to assess it. So I look at posture, mobility. I know what the movement of the shoulders, you know, the spine, all of that should be, the neck. I look at, address, and release birth trauma. Okay, I did a talk on this recently. Birth trauma, moms, just kind of think back. Real simple way is think back to the birth. Okay, if there's any kind of blips or parts of that birth flow from the first contraction to when you had your baby that stick out to you most, or cause some emotion to you, like you felt like things sped up or things got out of control, you weren't in control of what was going on, things didn't turn out the way that you expected it or that you wanted. So maybe you ended up in a C-section birth when you were really hoping for this unmedicated vaginal birth, or you know, somewhere along those lines. Did you get the support that you needed? That kind of stuff. So if you kind of think back, close your eyes and kind of you know, think back about and see your birth, and did it go the way that you were hoping? And if any of that brings up some emotion or frustration, anger, sadness, grief, you might be experiencing some birth trauma, and that can have an effect on your ability to produce milk, for your ability for you to bond and feed your child. Okay, so think about that. That is definitely something that is treatable, that I treat. And then let's see, I work closely with other professionals. So I do work closely with midwives and lactation consultants. You know, I go based on their recommendation as well, but it's a, you know, they have really good recommendations, and I'm just an adjunct to that, and to get you really the relief that you want. I've seen moms newly postpartum and help them out with breastfeeding issues in as little as 2 visits. Sometimes it takes longer. I can't always guarantee that's going to take 2 visits. Okay, but that's something that you know, we can talk about. So, and then lastly, I just want to mention that self-care and education is huge. I am big about empowering moms and giving them the education and accurate information about their bodies and what can be done about it. Give you hope, give you real tools on how to be successful at breastfeeding. Okay, so what I want you to do, if you are struggling right now, if you're listening to this and you know I'm talking to you, go to my website. That's the easiest way to get started. You can request a free discovery session. You can sit down with me in person, get your questions answered before. There's no obligation. There's nothing, you know, no pressure at all. We just simply sit down and we can talk. Or if you'd rather do that over the phone, you can schedule a phone consultation with me. Personally, I'll answer your questions. We'll take some time on the phone, and you can decide if, you know, if you want to move forward, if what I can offer you is a solution. Okay, so I do, like I said, offer a more comprehensive, maybe outside the box in some regards, approach to healing that you will not find down the street. Okay, so my website is healingspotpt.com. Go there. That's the best place to start. If you do have some questions that you want me to answer, just leave them below. I do check this regularly, and I'd be happy to help you out and get your questions answered. Okay, all right, I will talk to you guys later. Bye-bye.